What exactly is beyond the scale? We have with us Dr. Saumil Shah, who is the founder of MOH Clinics. He is also a practicing plastic surgeon since past many years, and he's been observing how traditional models have failed.
With obesity being classified as a disease, we need to treat it as a disease. And like every disease has a specific clinic for it, that is what we wanted to make MOH into. And obesity per se is not just about the weight, it's not just about the BMI, it's also about body composition. Because here this is not a diet plan. This is basically where we want to ensure that you don't have the side effects of muscle loss and other nutritional deficiencies.
Hello and welcome to Beyond the Scale. What exactly is Beyond the Scale? We are not here to sell a diet plan, or it's not another obesity clinic. We are here to help you lose weight sustainably. Have you ever wondered, people like us who are watching this podcast right now, we have tried weight loss multiple times, the weight has come back. There is a science behind this, and we are here to uncover that science. We have with us Dr. Saumil Shah, who is the founder of MOH Clinics. He is also a practicing plastic surgeon since past many years, and he's been observing how traditional models have failed. He's come up and he's put together a team of passionate doctors who will help us in this journey of weight loss. So let's hear it from him. Hello, Dr. Saumil. Welcome to Beyond the Scale. Would you like to tell us something about MOH before we get into the conversation?
Thanks, Jhanvi, for having me. It's really wonderful to start this series. Excited to help patients out with obesity who are suffering since long. MOH is basically Metabolic and Obesity Health Clinic.
Okay.
It's a clinic specifically geared and only geared towards obesity health. So we are not doing other endocrine problems. We will help patients who are having obesity because of other endocrine problems, but we are not doing just like a simple clinic. We are going to be targeting obesity from a multidisciplinary approach, where we are going to have different really passionate team members who are going to be different doctors from different fields coming to obesity or trying to treat obesity for patients, so that they don't just lose weight, but they also sustain that weight loss for long. With obesity being classified as a disease, we need to treat it as a disease. And like every disease has a specific clinic for it, that is what we wanted to make MOH into. It's going to be basically a metabolic and a obesity health clinic.
So, Dr. Saumil, could you throw some light on the science behind the weight loss and how MOH Clinic is going to be different as compared to the regular platforms which are available?
So, very true. I mean, there are going to be a lot of obesity clinics popping up because of the GLP-1 drugs that are out there now. There are a few things as to, so let me start from the beginning as to why we started this. So, being a plastic surgeon since many years, so this drug has been available in the US. Like semaglutide got available in the US by 2016, and we are having patients who have been on these drugs, and say from 2018 2019 onwards, we started having patients come to the clinic, come to me specifically in India after weight loss, because they would have hanging skin, and so we would do resection surgeries for them that would be needed after weight loss. These were not new surgeries. Earlier we used to do this for post bariatric surgery patients, but we started seeing more and more patients getting onto these medications. Patients from US, patients from all over Europe and other countries would come in for this. At the time, we then started speaking to a lot of these patients, and we realized a few things. I realized a few things, that just weight loss, so they all struggle with the same thing, and just weight loss per se was very easy to do for a lot of these patients. And this we see in our day-to-day life as well. Just losing weight is the easiest part of the weight loss journey. That is the first time. But then sustaining that weight loss, and then again getting to that weight loss as you start getting older, as you have done things multiple times, is the most difficult part of the weight loss journey. Now, where most traditional methods lie are, helping you lose weight. And then sustainably, just most of us doctors would also tell our patients, oh, you go and exercise, you go and diet, that's it. I mean, uh, what is the reason behind why the patient is not able to do the things that we tell them is something that we were not looking at. And that was the entire concept behind why we wanted to do the MOH clinic. With MOH clinic, we are going to have specialists who are going to help patients at every stage to lose weight in a healthy manner, lose weight in a sustainable manner, and keep that weight down. And so that hand holding is going to happen for a very long time.
Wow, that's fantastic. Someone like me, I've also lost weight in the past and gained it all back. And I totally relate to what you're trying to say. So, Dr. Saumil, how are you structuring MOH, which will help in sustainable weight loss?
Okay, so let's break it down sort of. Let's start with who are the people who are going to be, or the doctors and the specialists and the experts who are going to be involved in this. First is going to be the endocrinologist. With the GLP-1 drugs coming in, they are like an absolute boon to persons with obesity. The reason for this is obesity per se is a disease process. What do we mean by that? And it's also classified now and known scientifically as a chronic relapsing disease. What do these two words mean? Chronic means that it is going to go on for longer. Relapsing means that if you don't take care, you will keep getting the obesity again and again. So unlike, say, something like a malaria, where once you treat it, it's not going to come back, obesity, if it's not a single time treatment, you have to keep working on it. To this, I want to also add that it's a progressive disease, which means that if you don't work on it, the obesity may keep on increasing. So you may keep on putting on weight. And obesity per se is not just about the weight, it's not just about the BMI, it's also about body composition. So patients with obesity put on a lot of fat. Again, fat in different areas, something called as visceral fat, which is what basically causes all the problems in the long run. Things like heart attack, things like stroke, liver cirrhosis, and all of these things are because the fat is being deposited around your organs, in your arteries, and all of these things. So health wise, it is something that causes a lot of problems to a lot of people. And that's the reason why we want to tackle it in a way where GLP-1 drugs have made it like a simpler process, a easier process, a process where it will help patients to do that what they need to do. We have to understand that obesity is not by itself just a disease that you have more fat, or a disease of just calories that you eat less, or a disease of just exercise that you do one thing and it's done. It's a disease also of the brain. There's a survival instinct in us to eat food. This sometimes overrides the higher brain, sort of to say, which you everyone knows that putting on weight is not good, eating junk is not good, eating too much food, overeating is not good. But we do this because there's a psychological aspect to it and a physical aspect in your brain which has been conditioned through evolution. What we're trying to do in this is that, one, the endocrinologist is the person who's going to be giving the GLP-1 drugs to our patients. As a result of this, we want to help break this cycle of being dependent or fighting against your own brain to try to lose weight. That is the first thing that the GLP-1 drugs will help with. They will help with a lot of things and it will help with weight loss. But one of the major things it will help with is trying to remove what Oprah also called food noise. So this is something that is very well known that can happen with GLP-1 drugs. Now, there are a few things that we need to know. The GLP-1 drugs by themselves, because they are very effective, they also have some minor side effects. They don't have like major side effects like the negative things that are coming up on Instagram. But because they have those minor side effects and because they can cause things like muscle loss, it needs to be taken under supervision of the endocrinologist. So that's why we have the endocrino who's going to be the expert, who's going to be monitoring our patients, prescribing these drugs and all of that. The next consultant we have that will be looking after all our patients is a nutritionist. The role of the nutritionist in this is basically to help patients to, one, avoid side effects related to GLP-1 caused by inappropriate food behaviors. And one of the main things that they will have to do, so they won't be helping patients to lose weight like normal diet plans do. Their main role is to help sustain nutrition for these patients. They will help them have adequate proteins. They will help them understand if they're having some micronutrient deficiencies. They will make them sort of take proper carbs and which are the good carbs to be taken because they are also essential. Otherwise, people start having very low energies. They will concentrate on hydration. They will help make plans for patient, walk through with them. We will have like weekly check-ins with patient as to how they are doing. So that is a lot of the hand holding that we want to do as far as nutrition is concerned, because that is a major part that gets affected, which is many times thought by patients as, oh, we will manage because we've had a lot of diet plans earlier. But this is something that we want to help patients, because here this is not a diet plan. This is basically where we want to ensure that you don't have the side effects of muscle loss and other nutritional deficiencies on medication. The third consultant would be a gym coach. So we have tied up with many coaches and health coaches. They sort of will work on the physical aspect of it. Strength training, resistance training of any kind is the most essential thing when you're losing weight. It's not related to just, on the drugs or on weight loss. Overall sustainability for a healthy life is to have good amount of muscle, and this is something that is very, 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 very important. You have to understand that if you don't have adequate muscle, that is one of the reasons why a lot of women in the poor perimenopausal, postmenopausal time have backache, knee pain. Of course, they have arthritis and other things developing, but loss of muscle mass because of loss of estrogen is again one of the major reasons for this happening. So muscle building is another major thing that we're looking at. Movement, flexibility, and all of these things are going to be very important. And we don't want patients who are losing weight to start becoming unhealthy. The fourth consultant, according to me, is someone who a lot of patients feel is not necessary for them, especially in India, which is a psychiatrist, a team of psychiatrists and psychologists. They are very essential because, as I said earlier, this is a disease of the brain. It's a disease of feeling and understanding about craving food. You know that you have to avoid that lot of food. You know that you have to avoid junk food. You know that you have to exercise. You are motivated to do that a lot of times, but a lot of the times you're not. You need to understand the trigger of what's happening with you. A person with obesity, so say if there are two people, even two sisters, and one person has the tendency to become obese and one person does not. The person who has the tendency to become obese, even if both of them do the same things, the person who has the tendency to become obese will become obese. So because it has to be treated like a disease, you also have to understand that the lifestyle changes have to be different for both of them. For a person who's becoming older but is not obese, they can have much more leeway. It's like a diabetic and a non-diabetic person. A diabetic person has to avoid sugar. They can't say that my non-diabetic friend is eating an ice cream, I'll have that too. So this is something that is very important from that point of view, that the psychology of that person, that patient, they need to understand themselves. And that is why therapy plays a major role. They need to understand what are the triggers for them eating. They need to understand whether they eat because of emotional issues, whether they are eating using food as a coping mechanism, whether they have actually clinically diagnosable any food related issues as well. So these are the things that the therapist will help them out with. Finally, we come to the fifth consultant, which is my part. I don't take part in the obesity per se, but my role comes in at the end. This is something that a lot of patients, when they start with, are very scared of, especially looking at celebrities, where they are scared that they will get like hollow cheeks, they will have hanging skin everywhere, and all of these issues. That is where my role comes in. Once the patient has achieved sustainable weight loss, they are stable at a particular weight, then we can do a lot of stuff for them, things like lower body lifts, upper body lifts, non-surgical options as well for patients who have not lost as much weight. Say it's like a 5-10 kg weight loss. Probably if the skin is good, we can do non-surgical options. If they have a lot of loose hanging skin, which can happen when somebody loses weight, whether it's not related to the medication. We used to do this earlier for post-bariatric patients as well. But if somebody is losing like 20, 30, 40 kilos of weight, you're going to have loose hanging skin in different parts of your body. So chest or breasts for women, back, your tummy, thighs, arms. We do lifts for all of these areas. these patients sort of actually have another body inside their body. So this is something that a lot of patients would come to me with, that they would say that they know they have lost a lot of weight, but their inches have not changed a lot. They don't feel very different when they look at themselves in the mirror. So what I would do for them as a plastic surgeon is basically help give them that confidence back, make them understand, or get their body to a place where they know where it is, where we get it, remove all of that hanging skin and get it at a place where they feel good about themselves. So because they have done the entire work, where they have sort of worked towards it, that's the whole role of me as a plastic surgeon. And in the clinic, basically we are going to be having all of these consultants together. And unlike where this thing where nobody knows what's happening, this is all going to be supervised and coordinated.
Wow, actually, Dr. Saumil, this really changes the way I look at weight loss now, and I think I'm going to be one of your patients. But this also, it also like arrive. I mean, there are a lot of questions in my
Right.
mind, after listening to you, like how safe is this? What would be the primary side effects if someone would start with a drug like this? Would the weight loss be very instant?
Right.
Is it like if I am losing 4 kilos, someone else will lose five, someone else may not lose? Could you throw some light
Okay.
on this,
So a
please?
lot to unpack then. This entire series is for all of these questions. We are
Okay,
going to be going through all of them with each expert that we meet.
sure.
Now, for example, things like, is this safe? We have an entire podcast that we're planning where we'll sit with the endocrinologist and go through all the side effects of this.
Okay,
Per se, I can tell you that it is one of the drugs. It is a drug that has been extensively tested. It's not an experimental treatment. It's we know what the side effects are. We know how to avoid them. We know what the dosages should be. So that is basically something that it's not a new drug. It's recently introduced like a year back now.
sure.
Even that is a long enough duration in India. But we have this drug for long and we know how safe it is and how to use it. How much weight you will lose, how quickly you will lose is something that's very difficult to say, because uh, it's the same as any weight loss mechanism. Some person may lose weight very quickly, some may not. The thing is whether this will give you instant weight loss. Absolutely not, and that is something that we don't want. Why we have the nutritionist and the gym coaches, and why you need to do like a high protein diet and good nutrition and the exercises, is for that very reason, that we don't want excessive weight loss. The name of our series is Beyond the Scale, and that is what we want to do. Your aim should not be to just change the move the needle on the scale. That itself is not being healthy. If you are doing this for cosmetic purposes, this is not the right thing to do. Losing weight for cosmetic purposes is never sustainable. It's never healthy. You need to lose weight so that you become healthier in life. We have obesity causing so many issues, including stroke, heart attack, cancers. So it's, people talk about root cause, root cause. This is a root cause of a lot of ailments that we have in our modern day. And so it's not something that you should be doing very lightly. What we want is for the body composition to change. We want patients muscles to increase, we want the fat to go down. The needle may change here or there. A sustainable weight loss is probably 1 kg per week or something of that sort. That is at the higher doses as well. We are not looking at the lower doses as to how they will be. The medications need to be taken in the right way, by the right doctors, by the right experts, so that you don't have side effects. And even if you have a few of the milder side effects, they can be sort of corrected and we can help patients with that. uh, One thing that I want to make very clear, this is not about just weight loss. It is about sustaining the weight loss, getting a person healthy, and sustaining that health so that the quality of life for a lot of people in the world improves. So, I'll give you a statistic. It's thought of that by 2030 or 2035, about half the world would be suffering from obesity. When you have this much of a disease that's coming up, it requires specialized treatment for it.
Tell me something. When we start with this program, what will the first 90 days look like?
So the first 90 days, okay. Basically, we start it off as a 3 month program. We are going to be having the endocrinologist giving you the prescriptions for the medications if you need them. So first of all, let's start. You will first come down for a first consultation, where most probably I will be seeing you in the initial days. We will sort of chart out a plan. We'll chart out the reasons why you're having the obesity, what's happening with you, what's not happening with you, and then you will then be sort of we will explain as to how the program works. uh, in the first 3 months, usually you have monthly consultations with the endocrinologist. You'll have consultations with the dietitian or the nutritionist. You'll have a consultation with the gym coaches. You'll have a consultation with the therapist. All of these people will sort of help. First of all, you yourself assess as to what the reason for your obesity is. Then we'll come to a conclusion. Then we sort of sit as a team, and every week discuss the patients that the entire team has seen and what's the best course for them. We'll come up again with a plan, and the clinic will sort of contact you. Okay, so this is what you should be doing, and this is after meeting everyone. This is what is the thing. I know it looks like a lot of consultations, but this is something that we want to get right. There are a lot of patients in whom we also decide sometimes not to give the medications if they are not fitting the criteria for the medications, and then we will be telling them other things. But accordingly, we sort of manage the whole plan. The thing is, I can't give you a straight answer to this because for every patient we customize their plan. So there's nothing like okay, you will be doing this for the first 3 months. For every patient the plan has to be customized. It has to be made so that it works for that patient. And so I can tell you what will happen when you come down first initially, and then from there, depending on what you have, we will be talking about this. We'll be partners with you in that entire obesity journey, because as I said, it's not a one time weight loss thing. If it was a weight loss thing, there is a straight plan to it, but we want it so that it sustains for longer. We can sort of be your partners for many years to come.
Sure, Dr. Saumil. This actually clears a lot of myths about 1200 calorie diet and 10,000 steps and so on and so forth that's there in the market. Definitely helps. So, of course, for this journey, you are going to administer GLP-1 drugs.
Yes.
Could you throw some more light on the most talked drug, that is Mounjaro,
Right.
please?
Okay, so GLP-1 drugs are something that we won't be giving to every patient who walks in. So it's not like paracetamol. Ki, I want a paracetamol, to chalo de diya ek baar. These are drugs that are to be given when once we assess that you are someone who will benefit from them. Okay. It's to be given for a specified amount of time by a specified specialist. These are not drugs that should be taken over the counter. These are not supplements. So we don't just give them very lightly. We also understand that sometimes patient may require long-term maintenance on these drugs as well. So before starting them, the assessment is very rigorous. Let me give you a basic of what the GLP-1 drugs are. So you have two drugs in the market right now, which are basically the GLP-1 drugs actually started in 2009, and they were there for diabetes for a very long time. In 2016, the present Ozempic was introduced in United States, which is basically semaglutide. So there is a drug called semaglutide. Ozempic has been was approved for for diabetes at the time, and Wegovy was then approved for weight loss. They're basically the same drug. Now in India, as of my speaking, which is in March, mid-March, we are having a lot of Indian companies coming out with semaglutide because the patent has run out, and so hopefully that will become something that becomes more accessible to a lot more patients. So that is what is Ozempic and Wegovy. Second is Mounjaro. Mounjaro is basically a medicine called tirzepatide. It is what we call as a dual receptor agonist, which is not just GLP-1, it is GLP-1 and GIP. So when you come down for a consultation, we talk more in detail about why these things matter, as to why a dual agonist is there, what is a single agonist, where Mounjaro is better, what is there with semaglutide. So where tirzepatide is better, what is better with semaglutide. In India, there is another brand called Urpic, which is by Cipla, which is basically a license deal from Mounjaro. So there are going to be, Mounjaro is not running out of its patent, so it's going to stay as Mounjaro, and we're not going to have Indian companies coming up with it. But there are a lot of semaglutide companies coming out with semaglutide. depending on what you need, how you need, which drug is to be given, uh, what financial constraints you have as well, and what are your goals. We'll be prescribing different medications for different people. So again, there is not going to be a set pattern that okay, you come to us, we'll give you Monjaro. You come to us, we'll give you Ozempic. You come to us, we'll give you Wegovy. So there's nothing like that. Depends on what your goals are, how much you can afford, for how long you want to take it, and all of these things. It will also depend on things like whether you have diabetes, whether you don't have diabetes, you're someone who's only looking to lose weight. So multiple things will contribute towards us deciding what to give you. The endocrinologist will take all of these into account before he decides what's to be given.
So it's really nice to know that there's so much science behind this, and now we also know that it's just not one formula for everyone. So thank you for throwing light. This just brings me to one last thought. Like right now, India is called as the obesity capital of the world,
Yes.
and a lot of children are also in this. Like in the obese
Yes.
category, thanks to all the junk food available,
Yes.
stress, and like you mentioned, obesity as a disease. So, do you think that this kind of a treatment is advised for kids as well,
Okay.
or
So, very important, we are not giving GLP-1 drugs to anyone below 18 years of age. It has not been studied in the pediatric population, so we would not be giving to any pediatric populations. But we definitely have nutritionists. We have other ways of dealing with pediatric. Um, so counseling also of parents becomes important in pediatric obesity. So pediatric obesity is where actually the obesity starts. If we can work on it, where we can sort of explain this to patients, explain this to parents, uh, they are the people who are going to be responsible for their kids. We don't give them to kids for the simple reason that we don't know what it does in kids. They have not been studied in kids. We Unless the indications come out for it, that is when we do it. But nutritionally, what's to be done and all of that is something that we know for kids. We know that it is the first 6 years of life that kids develop taste. It is the first 6 years of life when they build up all their fat cells. If in this period we can sort of help our children, sort of get into better habits, the obesity by itself will not happen in a lot of these kids, because of course it's a genetic problem, but there are also a lot of environmental factors to it, and of them being exposed to diets high in sugar, diets high in other things are very important, which we'll also be talking with our nutritionist about in the upcoming podcast. So you can sort of look at that as well. But in pediatric patients, we definitely won't be giving these medications.
definitely? So, also, Dr. Saumil, you mentioned that strength training is going to be a very
Yes.
important part. Now, a lot of times I've observed that, people are obese because they do not get the time to exercise.
Right.
They can use it as an excuse, or genuinely they do not have
Right.
the time. So, would the plan fail if a person doesn't do strength training?
Okay. Let me give you this thing that we used to say in our MBBS a lot. Uh, there would be a professor who would say this. Basically, muscle is life. Okay. If you feel your health is not your priority, you're not going to give time to your health. To say I don't have time is basically to say that your health is right now not your priority. This happens to a lot of our patients in the corporate world because they are doing, especially in a city like Mumbai, where they are traveling 2-3 hours,
Yeah.
then they are having a job of 12 hours. Plus, when they come back home, they are still on their computers, and they feel that I don't have the time. How am I going to do it? It's very simple. If you don't work on your muscles, whether you're losing weight through medications, whether you want to lose weight through dieting, whether you want to do like a bariatric surgery, you're going to have a lot of muscle loss. Once you have muscle loss, you're going to have low energy, fatigue, chronic leg pain, knee pain, back pain, other issues propping up as well. These are things that are very, very important. Muscles are not just things that help you look big, like big biceps. The muscles we're talking about are the anti-gravity muscles. These are like your abs, your back, your pelvic muscles, your thigh muscles, your glutes. These are muscles which are very, very, very important for a good quality of life. If you're not building muscle, I would say, in fact, you should not lose weight, because what would happen is when you look to lose weight, the first thing your body will lose is proteins. What you will lose is muscle. Your body composition will change, where your fat percentage will go up, your muscle percentage will go down, and that is in fact worse. we have patients who are very slim. Yeah, in India we have very slim patients as well, but because they don't have adequate muscle mass, the percentage of fat in their body is the same that an obese person would have, and so their risks of getting things like diabetes, heart attack, stroke, all of these stay the same as that of an obese person. So that's why. So again, we come to the same thing. It's not just the scale that needs to sort of change, it needs to move. It's not the BMI that needs to fall, it's the body composition that needs to change. So you cannot do weight loss without muscle building, or at least keeping your muscle strength, and that is very, 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 very important.
Thank you, Dr. Saumil. I think this throws a lot of insights, and today I think I'm walking back with so many questions in my mind, and that's the reason why I feel that let's step into this series.
Yes.
Let's get into detailed discussions about all the. Let's get into a detailed discussion about the various steps in the journey. Maybe we could do it with each consultant who is going to talk
Yes.
about their field independently, and I'm really looking forward to this. If you are someone who's looking at sustainable weight loss, please stay glued to this.